Good afternoon. I'm Isobel Mackenzie, Seniors Advocate for the Province of British Columbia, and it's my pleasure to speak to you from the ancestral lands of the Lekwungen-speaking people of the Esquimalt and Songhees First Nations here in Victoria. Today I'm going to be presenting the results of my office's recent systemic review of assisted living in British Columbia. And before I begin that, I want to thank the many people who helped in the making of this report, a very diligent staff back in my office, and in particular my colleague of over 30 years, Robin McMillan, who I dragged out of retirement to be able to assist us in this review, and her insights and her guidance were invaluable, and I want to thank everybody that participated in this report. So the first thing I want to highlight is just what do we mean by assisted living and where does it fit in the continuum of housing for British Columbia seniors as they age. Most seniors in BC, 95%, live in their own home in a private dwelling unit. About half of those are single-family homes, and about the other half are a combination of apartments, condominiums, townhouses, duplex, what we would call a common wall sharing with the other dwelling unit. Of the other 5% of people over 65, they live in a variety of housing options along a continuum. First is what we talk about in BC as independent living, and this is where you have your own apartment, but you share meals and some social activities with other people in the building. You could be very active, you might still be driving your car, you may have no care needs. It's really seen as a social model of care. Then we have assisted living, which is an environment similar to independent living where you're sharing your meals and having social activities together and you get your own apartment unit, but there are personal support needs provided to you if you need them by staff who are hired by the facility or the site where you're living. And then we have long-term care or complex care, which is nursing homes where people need higher intensity of care and services. There's 24-hour staffing. There are people living there who don't have the ability to direct their own care, and there's a much more rigorous level of oversight, regulation, and inspection. So in terms of what we have in BC, for independent living, and these numbers are approximate for independent living because part of the challenge is we don't have a registry. We don't know exactly how many units are out there and how many sites are out there. We have always relied on the Canadian Mortgage and Housing Corporation, CMHC, to produce an annual report of inventory of these units. However, they've stopped doing that, so the data we have is 2 years old. But at that point in time, we had about 21,000 units of independent living, and over a 5-year period, the number of units of independent living had grown by about 9%. Assisted living units, which we do have an accurate count on because assisted living units are registered with the provincial registrar of assisted living. We know that there are 8,400 units of assisted living in the province. 4,400 of them are subsidized by government. People living there pay a portion of their income to live there, and the rest of the cost is funded by government. And 4,000 of them, just a little under half, are private pay. They don't receive any government subsidy, but they are under the Community Care and Assisted Living Act. Over the last 5 years, we've seen 2% growth in assisted living, almost entirely in the private pay sector. There's been no growth in the subsidized sector. For long-term care beds, we have about 29,000 long-term care beds in the province. There's been about a 2% increase in that over the last 5 years. About 28,000 of those beds are subsidized, and about 1,500 of them are private pay co-located in a facility that also delivers subsidized beds. So the growth in long-term care has been in subsidized long-term care. It's grown 3% over the last 5 years. And the private sector long-term care has actually contracted. It's shrunk by about 2% in the last 5 years. So as we went about this review, what were our findings? Well, can basically be summarized in 4 key points. Number 1, a lot of confusion about what's assisted living, what's not assisted living. Issues around affordability, not just in the private pay market, but actually issues around affordability in our publicly subsidized assisted living. Issues around tenancy protection, and I'm going to talk about that a little bit more in the presentation, but in theory, everyone who's renting their unit should enjoy the protections of the Residential Tenancy Act or the oversight of the Community Care and Assisted Living Act. And what we found over the course of this review was that there is a large swath of seniors who have been exempted by from the Residential Tenancy Act by the operators of the building. And that is not correct, and we need to make sure that that gets corrected as we move forward. And issues around quality assurance, that there are some gaps in the reporting and the requirements of what is reported in assisted living that really isn't allowing us enough information to accurately gauge whether we're meeting the needs of seniors in assisted living, whether we're meeting the public goals of our subsidized assisted living program. So the confusion. So what's independent living? What's assisted living? The problem is they look and feel exactly the same. These are buildings where people come together in a dining room for 2 or 3 meals a day. They have common activities. They have social activities. They may go out for outings. People have their own units, their lockable units. They have their own bathroom. They often have, some have full kitchens. Others have a kitchenette. And then it becomes really confusing in buildings where you'll have 100 units and the operator has said, well, 30 of these units are going to be designated as assisted living and they're going to be registered with the Registrar of Assisted Living, and the other 70 units are going to be independent living. And this leaves everybody utterly confused, frankly, including myself. So tenants are confused. Am I assisted living? Am I not? Why is my neighbor able to get the care aids to help her and I can't get the care aids to help her, to help me? Why is my mother not getting the nightly checks that the other person is getting in the same building? And most importantly, why am I seeing increases in my fees each year that are far in excess of the allowable rent increase under the Residential Tenancy Act? And so it's clear that we have to make some significant clarifications, changes to both our legislation and to the practice out there in the industry to ensure that seniors and their family members are very clear on what they're getting, what they're paying for, and what their protections are. Affordability. Here we go. So I'm going to talk about affordability in publicly subsidized, first of all. So in general theory, if you're in a publicly subsidized assisted living unit, it's completely affordable for you. I would argue that's very true in long-term care, where we take 80% of your income. We guarantee you're going to be left with $345 at the end of the month, and absolutely everything is provided for you. 3 meals a day, all your care, your equipment, your medications, your supplies, everything is provided for you. In assisted living, this is not the case. We take 70% of income, so we take a little bit less than we take assisted living on our lowest income seniors, generally those who are on the GIS and OAS as their income. So the average income of a person in assisted living, subsidized assisted living in BC, is $25,000 a year, and the median income is $21,000 a year. So if we take the median income person, the $21,861 senior who is living in subsidized assisted living in this province, and this will be 50% of our residents in assisted living will fit this profile, their monthly income is $1,822. Their client contribution for assisted living at 70% of their income is $1,275. Now they have additional expenses because they've got medications, they need hearing aids, they have equipment needs, they have supply needs, they've got to pay for the toilet paper in their unit, they've got to pay for the little bottles of Palmolive liquid detergent to mop up in their kitchen. They've got about another $625 of expenses each month, and you can see that they're in the hole at the end of each month. Contrast that to where they would be if they were in long-term care. Their client contribution in long-term care would be slightly more. It would be $1,457, but their expenses would drop dramatically. Their medications are all paid for. They get their third meal provided. Any equipment they need is provided. Supplies, for example, incontinence supplies, are all provided for them in long-term care. And we are hearing increasingly from our residents in assisted living that they are finding it very challenging financially to stay in assisted living, and we know that some are choosing to go to long-term care because they can't afford assisted living. We know that in British Columbia we have a very relatively high percentage of long-term care residents whose care needs don't warrant long-term care. They could be in assisted living or at home with home supports. Subsidized assisted living is half the cost of long-term care and a fraction of the cost of acute care, but we are significantly underutilizing it. And despite the fact there's been a 52% increase in the funding for assisted living in the last 5 years without producing a single additional unit or increasing the service levels at all to the people who are living in assisted living. So clearly, there are some questions about that, but I think we also have to recognize increasingly, and this isn't the only example, where government will talk about their increases, at times significant increases in funding that aren't translating into increases in service because costs are going up. We don't know that that's all in a month. It could be as high as $5,500 a month. But that generally does not include any care. That is simply the rent for your apartment, your 2 meals a day, and your ability to participate in shared social activities. Anytime somebody is coming to your room to help you with your medication, help you with your bathing, you are charged in addition to that, generally in increments of 15 minutes. And what we've been able to figure out, it's about $11.50 for every 15-minute increment. So we calculated that on average people might have an hour a day of services for assisted living. That's about what we see in subsidized. So on average, that cost would be $58,600 a year to live in private pay assisted living. If your care needs were greater, it would cost more. There's no government subsidy there. You pay that all on your own. But if you moved to long-term care, because everybody qualifies for subsidized long-term care, you would pay $24,000 a year, and the government would pay $58,000 a year. So you can see the challenge when all of the subsidy is weighted on long-term care, and we're sort of, for want of a better term, starving the subsidized assisted living sector, where clearly some of the people in long-term care could live, but we've seen no growth in the number of units in the last 5 years. And in fact, if you use the rate per thousand of population, target population, it's actually a 15% decrease in the last 5 years in terms of the amount of subsidized assisted living that we're offering to the public. Now, the other thing that came to our attention in the course of this review, and it wasn't something we had contemplated as we started out doing this review, but it began with issues coming into my office, which led to questions, which led to reviews of residential tenancy branch decisions, and reviews of several contracts. And what we found was that the Residential Tenancy Act, which should be applied to everybody who is in independent living, was not being applied to everybody in independent living. So it's very, very clear when you look at the legislation. Those who live in independent living are protected by the Residential Tenancy Act. Why? Because they're not registered with the assisted living registrar. So if they're not protected by the Residential Tenancy Act and they're not registered with the Community Care and Assisted Living Registrar, they have absolutely no protection against eviction, usurious rent increases, or any other host of landlord-tenant issues that could arise. And indeed, our office is getting increasingly calls from people in independent living and some in assisted living, where they are being asked to pay fairly significant increases, some as high as 15% in 1 year. We have one example of somebody who was asked to pay an increase of, I think, 3 or 4% 3 months ago, and then got a notice of yet another increase of about 6% 3 or 4 months later. And so it is vitally important that everybody out there understand that regardless of what your landlord or your operator is telling you, regardless of whether you signed a paper that said, I'm exempt from the Residential Tenancy Act, you can't waive your rights to be protected under the Residential Tenancy Act. You are protected. And if you are experiencing issues such as significant increases in your rent, you need to call my office or call the Residential Tenancy Branch and begin the process of having those increases reviewed if they are outside the allowable rent increase. However, the other thing that we discovered in the course of this review and looking at this issue about tenancy protection, it has always been assumed that if you were in a registered assisted living unit, you were exempt from the Residential Tenancy Act because you were captured under the Community Care and Assisted Living Act, which does give you a number of protections. It protects you against, unreasonable evictions, and you have to get the services prominent. It doesn't have any price protection, but it did have some oversight and some protections. And back in 2006, the government of the day decided that, in fact, assisted living should be included in the Residential Tenancy Act, and they passed the Tenancy Statutes Amendment Act in 2006. Now, it's never been enacted, but the legislation was passed. And in the 2012 report of the Ombudsperson, Best of Care, it was recommended that assisted living be included in the Residential Tenancy Act. And indeed, if you go to the government website today, it's going to tell you that assisted living must be registered, but that the Residential Tenancy Act does not apply. There's no language that we could find in either the Residential Tenancy Act or the Community Care and Assisted Living Act that actually excludes assisted living from the protections of the Residential Tenancy Act. It's clear everybody thought it was. And so there needs to be a review of that and an understanding about if legislative changes need to be made to include assisted living under Residential Tenancy Act protections, then that's what we need to do. However, if we discover, in fact, they were never exempted, then we need to ensure that operators and tenants understand the implications of the protections that they now are afforded as it's recognized that they're under the Residential Tenancy Act. And then there's the issue of just quality assurance overall in assisted living. And we have to remember assisted living is not meant to be long-term care. It is explicitly designed to be a more independent living model of housing for people who need moderate supports. You can't live in assisted living if you're not able to direct your own care, for example. Whereas people who are unable to direct their own care and make decisions for themselves often live in long-term care. So we have to keep that in mind and not over-regulate or over-impose rigors on assisted living and make it de facto long-term care. But we could do more than we're doing now, and we should certainly be doing more for our publicly subsidized assisted living units. So, for example, we currently have no requirement for annual site inspections. The recent changes to the legislation of, I think it was about 3 years ago, did allow for inspections for things other than complaints. Prior to that, the registrar couldn't inspect the site unless there was a complaint. Now, the registrar can go in and conduct an inspection even without a complaint. However, with that, last year, less than half of the sites were inspected. It was only 41% of assisted living sites received an inspection. Compare that to long-term care, where we are routinely in the high 80s and 90s in terms of our facilities that are inspected each year. We don't track or support the hours of care in either public or private. There's a question about whether that's relevant in private care, but I think it certainly is in public care, where we're spending this $138 million of public money. Who's getting what? What are the trends? We need to track that better. There are no required staffing levels or qualifications of staffing for either our subsidized or our private pay assisted living. And I think we need to look at whether that is required as we move to the future, and again, particularly around our publicly subsidized. And then just overall accountability for the public subsidies that are received by the operators of assisted living. Where is this money going? How is it being spent? And how can the public be assured that it's getting good value for its money? So overall, at the conclusion of this review, my office is making 5 recommendations. So first, without a doubt, significantly increase the capacity of publicly subsidized assisted living program with more units and expanded services. The proportional wait list for assisted living is 50% longer than long-term care, number 1. Assisted living, currently, half of the people living in subsidized assisted living are at high or very high risk of placement in long-term care. They're Maple 4s or 5s. We can and do care for people with fairly high support needs in our subsidized assisted living, and we do it at half the cost of long-term care. But we don't have nearly enough units, and the units we have are focusing on a very specific population and missing a broader population that could benefit from subsidized or some other version of affordable assisted living. We need to reduce the confusion seniors and family members experience while navigating assisted living and other congregate living arrangements. If anybody out there has had the experience, they will absolutely know. I think there's an expression, tacking jello to a wall, trying to figure out, okay, what is my mom getting here? What are we paying for? What's regulated? What cost increases can we expect? I thought this was assisted living. What do you mean mom's in independent living? It's all utterly confusing. And I think that it has to be recognized that mixing classifications of residency in the same building is significantly adding to this confusion, and it may not be possible to sort it out without requiring a building to either be assisted living or independent living. That in and of itself would clarify a lot of the confusion out there. And then we have to make sure that everyone understands if you are in assisted living, this is what you're covered by, Residential Tenancy Act. There's no other protections here. It's a buyer beware kind of situation. And if you're in registered assisted living, you are under the protections of the registrar. Here's what that means. And here are the protections you have against cost increases, either because we've folded it into the Residential Tenancy Act or we've come up with a different regime to protect people from price increases, unreasonable price increases in assisted living. We need to provide this explicit tenancy protection, as I said, both for people living in congregate living, whether it's assisted living or independent living. Independent living has it now, but there have unfortunately been a number of past decisions by the residential tenancy branch. So what has happened is an operator, a tenant, has received a notice of a rent increase of whatever, call it 8%. And the allowable rent increase for that year might have been 2% or 4% or whatever. And so they've applied to the residential tenancy branch and they've said this increase is outside the allowable rent increase, and they get a hearing. And the poor senior goes to the hearing, but the operator comes to the hearing, often with their legal counsel, and says, no, we're not covered by the Residential Tenancy Act, because if you look at this clause within the Residential Tenancy Act that says healthcare, we provide those. And the person says, but I'm not paying for those. I don't get any of those. And the operator says, well, no, but we provide them. And some of the adjudicators have ruled in their favor, in part because nobody was there to represent the seniors, and nobody was there to explain that if they're not under the Residential Tenancy Act, These operators are not registering these units with assisted living, which I believe some of the arbitrators thought they were. We supported a recent case that went to arbitration on this issue, and indeed the arbitrator ruled in favor of the tenant and found that indeed, notwithstanding previous adjudicative decisions, which are not binding, that the tenant was covered by the Residential Tenancy Act, and that they will adjudicate the issue of the increase that is beyond what is the allowable rent increase that's been posted by the province. We need to address the affordability issues, both in publicly subsidized actually and in private pay. So in publicly subsidized, we have to look at how much money they have left over. 70% may be reasonable if your income is high, because you're going to be left over with more money. It may not be reasonable on these low incomes, given how much you still have to pay for when you're in assisted living. In terms of private pay, whether it is about regulating the actual cost or whether it is about offering some sense of outside protection for people against unreasonable cost increases, I think we have to allow for the fact that operators will have increased costs. They have to be able to meet those increased costs. If they can't, they won't be able to deliver the services. Most operators will behave responsibly around the increases that they need to pass on to the tenants, but not all will. And so we need to think about how we're going to protect seniors against the unreasonable cost increases for the services that are provided in assisted living. And we need to strengthen the current monitoring and enforcement systems to provide quality assurance, resident safety, and value for investment in publicly subsidized assisted living. So part of this is around just the oversight of what's happening in assisted living, where people who are living there are expecting some protections and oversight. That's part of what we need to strengthen and look at where the gaps are. And then there's the piece around the units, the 52% of our units that receive public subsidy. How are we accounting for those public dollars? And do we have an additional layer of oversight that's provided there because of that? So it's my hope that the province will move forward with these recommendations, that it may require that they do a very comprehensive review of not just the Act, but the whole program. It's 20 years old now. It's maybe time to take a look at what was our intended purpose in this program, and are we meeting these purposes, and how are we going to make this assisted living program work as we look at the future. Our wait lists for long-term care are growing, and they've accelerated in their rate of growth in the last 3 to 4 years, which is to be expected given what we're seeing in the aging population. We absolutely need to look at every element of support in the continuum, including assisted living, as a way of addressing the incrementally increasing needs of people as they age, so that we aren't forcing people to jump right into the most expensive option, which is long-term care. And with that, I will be happy to take any questions that people might have.
A reminder to reporters on the line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up. We'll start in the room. Our first question today comes from Keith Baldry, Global TV.
So a zero increase in units in 5 years when our population's gone up, what, 7, 8, 9%? How many units are required to say significantly increased capacity? Are we talking hundreds of units are now required to keep pace with the population growth?
Yes. Yes, I mean, we've, in real terms, as an economist would say, we've gone down 15% in the last 5 years when you look at the target population. Now, part of the solution could be in these buildings where you have mixtures of independent living and you have assisted living, converting some of the private pay assisted living to publicly subsidized, and transitioning some of those, making the independent livings units subsidized assisted living. There is some capacity, excess capacity, in the private pay, independent living, and depending on where you are, in the private pay assisted living, a little bit. There used to be a lot. It's tightened a bit. but there is a bit there. So one option for government to explore is simply, for want of a better term, going in and buying up this excess capacity. I do think they're going to have to transition to a model where the building is either all assisted living or all independent living. And I think it's really got to be all subsidized or not subsidized, because just like in long-term care, when we're mixing subsidized and private pay in the same building is where we have the problems. It's where we have the problems in long-term care. It's where we have the problems in assisted living.
Keith, did you have a follow-up?
Yes, on this tenancy protection situation, as you outlined, there seems to be inconsistent rulings or arbitrations from the residential tenancy branch. Does the Residential Tenancy Act need to be amended to explicitly lay out what the rules are so there's no inconsistency?
Well, the arbitrators, first of all, their decisions are not binding or precedent setting. So on the same set of facts, two arbitrators can come to a different conclusion. And indeed, that's what's happened with this latest arbitration on this particular issue about the application of the Residential Tenancy Act. I think it is more a clarification under the Community Care and Assisted Living Act around tenancy. If it was explicit tenancy protection for assisted living, the point would be moot. I think that we are increasingly going to raise awareness about that people have tenancy protections. One of the reasons why it's been out there simmering for a long time and nobody's paid any attention is because prior to COVID, almost without exception, every year the rate increase, rent increase was cost of living plus 2%. So most operators weren't raising anything by more than cost of living plus 2%. What's happened now is we have high inflation and we have a rent cap that's below inflation. So you have operators who are enforcing what they see as their right, which I'm not bound by the cap. By coincidence, that's what I used to raise it by, but that's when it was inflation plus 2%. And people are saying, well, wait a minute, that's more than you're allowed to. There is this other issue around, there's a portion, let's say you're paying $3,500 a month. There's a portion of that is your rent and a portion of that is your service package. So the portion that's your rent would be subject, obviously, to rent increase caps. You can apply for SAFER on your rent, et cetera, and then your service package. And so we also have to be mindful of the ability of the operator to pass on costs in the service package that aren't seen as being, even if they are under Residential Tenancy Act, part of their tenancy agreement, right? And that's where we need to look at, okay, what's going to be reasonable here? Because I can believe that it may not be reasonable to restrict an operator to a 2% increase on their service contract when inflation is 6% and their labor and food costs have gone up. So we've got to find something there that protects actually both the operators and also the residents. But right now, the way we've got it out there, it's kind of like the Wild West for some of these people who have who've been told they have no protections.
Next, we'll go to the phone. Leanne Young, CBC.
Hi, Isobel. Thanks for this. So if you could, sum up, if there's the one pressing need that you could bring to the government right now for them to review, what would it be?
The most pressing need is we need to increase the number of subsidized assisted living units. That is the most pressing need. The tenancy protections for the people who've been told they're not under the Residential Tenancy Act, actually they do have those tenancy protections. We just need to make sure everybody is aware of that. The issue around whether assisted living is covered under the Residential Tenancy Act or not, I think warrants a review by BC Housing, by Ministry of Attorney General, and by Ministry of Health to look at why we thought they were exempted, given the language that exists, and make a decision about they're in or they're out. And if they're out, then look at reintroducing the tenancy amendment statute that was passed in 2006 to explicitly include them in the Act.
Leanne, do you have a follow-up?
Yeah, I do. Thanks for that answer. I also wanted to know if this has been brought up with the province, if your report is brought up with the province, and what the reaction has been so far.
I'm sorry, I didn't quite hear that question.
Yeah, I just wanted to know if your report has been brought up to the province already and what their response has been so far.
Yes, the province has received the response. They share with me this confusion about assisted living and the Tenancy Act, because as I say, we were all operating under one assumption and it's not clear we were operating under the correct assumption. The issue around the tenancy protection for people in independent living, they agree they are protected under the Residential Tenancy Act, and there wasn't a fullness of facts presented at some of these RTB hearings, and I'm hoping that, in fact, the Ministry of Housing issued a clarifying bulletin or policy back in March of this year to its adjudicators, expressly stating that independent living was to be considered under the Residential Tenancy Act. In terms of the increase in subsidized units of assisted living, to be fair, it's part of the bigger, I don't know if ask is the right word, but the bigger considerations the province is mulling over at the moment around, they've got pressures for new long-term care beds, refurbished long-term care beds. We still have some, 3-bed wards out there. I don't think there's any 4 beds left, but we certainly have 3 beds and some with 2 beds, and we need to get that fixed and modernized in those facilities. The thing about assisted living that could happen, because we have this phenomenon of some excess capacity in the private sector, and I think the Industry Association issued a paper on this recently that spoke to it, wanting to get some more government subsidy because they had some empty units, right? And so if people could be subsidized, they could live in those units. We can make some moves on that quickly, and we can take some of the pressure off our wait list for long-term care. Don't forget, 60% of the people entering long-term care in this province are entering it with no home supports, they haven't come out of assisted living, and we know that about certainly 1 out of 10 of those people, if not more, could be placed in assisted living, that their care needs are consistent with the support services that we offer in assisted living. We just don't have any assisted living places for them. For some of them, it's unaffordable to be in assisted living, but it's affordable to be in long-term care. We've got to fix that piece as well. That piece is a little bit more straightforward to fix.
Next, we have Mary Brooke, Island Social Trends.
Hi, thanks. Isobel, you mentioned a few minutes ago that among the assisted living units, that the ones that exist right now are only serving a certain type of client or situation. Is that like a building structure, a room structure issue? What other types of buildings or units should be built?
When I said a certain type of client, it was more when we're looking at the incomes of the people who are in our subsidized assisted living, they're very, very low. They are reflecting, for the most part, people who are on the GIS, which is about 30% of our population. What's happening is the seniors who have low incomes but aren't as low as GIS. So, for example, someone at $29,000 a year earns too much income to be on the GIS. They're not finding the places in subsidized assisted living to the same degree. And so, we need to understand that this issue around what are the relative low incomes of most seniors, and that they have their care needs are not being met because of the financial constraints, and our publicly subsidized system is too expensive for them. So whether it's the home support copay that we charge them, or whether it's the 70% for assisted living, or the fact that we don't put them on the waiting list for subsidized assisted living.
Mary, do you have a follow-up?
So CMHC, what kind of data do they provide right now about assisted living or long-term care facilities?
They have stopped providing the data on these independent living units. We have the data on assisted living, and we have the data on long-term care because they're licensed and they're registered. What we don't have is all these other buildings, which arguably don't need to be regulated. I think there's an argument to look at registering them so we know who's out there and where's what. We certainly found that during COVID, this confusion over what is assisted living, what's independent living, what could get covered by what public health orders, and this utter confusion in sites where, 30 people were under the Assisted Living Act and captured in the public health orders, and 70 other people who were in the same dining room were in independent living and weren't captured by the legislation and the public health orders. I think we need to look at that. I think we need to give the industry the confidence or the security of knowing that if you're, being registering and regulating are two different things, because we don't really know what's out there now. We sort of have a minimum. We know, as I say, there's about 21,000 units. There might be more, and they weren't captured by CMHC. We don't know that. And we know a relative rate of growth over the last 5 years up until 2 years ago.
That's all the questions we have for today. That concludes today's event. Thank you.
Thank you very much.